Trumbull County.
Here it is, the news about the coronavirus.
Other healthcare indicators.
That's right,
in the last 2 weeks,
the news about the coronavirus.
68 cases per 100,000 residents. From June 16th until the 27th of June, the average new cases per day doubled from 8 to 17. More residents are visiting the emergency department. From June 16th to the 29th, visits for COVID-19 to the emergency department increased from an average of 3 per day to 8 per day. Trumbull County residents are being admitted to the hospital with the average number growing from 1 to 6 on June 16th, from 1 on June 16th to 4 on July 1. Trumbull County currently has an outbreak in an apartment complex and several long-term care facilities. Wood County. During the last 3 weeks, Wood County's COVID-19 cases have increased along with several other indicators. During the last 2 weeks, Wood County had a total of 63 cases per 100,000 residents. Over 18% of Wood County's total cases have been in the last 2 weeks. From June 16th until July 11th, the average daily new cases significantly increased from less than 1 to 9. Due to clinical, over 89% of the cases are not in congregate settings, signaling that we do have community spread. The community is also experiencing early signs that people are seeking medical care for COVID-19. Between June 16th and July 2nd, the average outpatient visits nearly doubled from 3 to 6 per day. Now let me look here. We had a couple other things. John, I'm going to look at this map a moment. I'm going to refer to you, and then I'll come right back, and then we'll get to questions.
Sure. Good afternoon, and I have a few things on the job training, medical advancement, and sports fronts. And let me start with the launch of IMAP, which is a job training program. Many of you have heard me talk about TechCred, which is our effort to get employers to upgrade, upskill the people in their workforce. And as people are trying to get back to work, if you look at the Ohio Meets Jobs website, you see there's 120,000 jobs on there that are currently available. 60,000 of them pay more than $50,000 a year. But if you look, you're going to see that tech skills are an important part of landing those higher paying jobs that are part of our landscape. And so we're announcing today the $2.5 million grant opportunity under the Individual Micro-Credential Assistant Program, or IMAP as we're calling it. Today, this is for the providers to register so that they can provide these skills. The grant application is open to those training providers today. Those can be universities, colleges, our Ohio Technical Career Centers, and private sector training groups, because we know that there are a lot of them that are really doing a great job of getting the tech skills developed in their workforce. And this program was created in partnership with the Ohio Legislature last year. I want to thank them for their efforts. It will provide up to $3,000 of training reimbursement for an individual, and you can find out more information at imap.development.ohio.gov. We're going to ask the training providers first to go and apply for this, which will wrap up on July 24th, and then we'll have an announcement of how individuals can go about applying for this. But wanted to put it on their radar screen to get the training providers involved so that they can qualify for this and we can get people trained up to tackle some of these opportunities that are growing as we come out of the economic slowdown. And as we do that, I also want to highlight shared work and the shared work executive order that the governor signed on July the 2nd. This will allow the Ohio Department of Job and Family Services to draw down federal dollars authorized under the CARES Act for the shared work program. And I've talked about shared work before, but let me just give a quick review of this, because this is a great program for employers and employees. It's designed to keep people working. And we know that when you have an economic slowdown, that you may not have enough work for all of your employees, but you want to keep them on the job. You want to retain their talent for when the economy picks back up and you can use them full time. Well, this program, Shared Work, is designed for this kind of activity. And let me give you a few details on how it works. Employers who want to reduce staff and reduce their hours in a uniform percentage between 10 and 50%. So they're going to reduce hours for employees between 10 and 50% of a maximum of up to 52 weeks. This will keep people employed. At the same time, those employees will receive shared work compensation for the remaining hours, which is prorated as an unemployment benefit. So you can work, draw down your salary for that, and then for those hours that the employer is shortening that, you can draw down unemployment compensation. And the program is easy to use and gives a lot of flexibility to employers. Just so you know, since March the 15th, when we started to push this, 909 employers have used it. 1,680 shared work Ohio plans have been advanced, and that has allowed 46,352 employees to stay on the job and still have the opportunity to reduce their work and also get compensated for the hours that they're not working. So that's really working well to keep people employed in Ohio, and we want to keep that going. And then let me also add some good news on the medical front, and I want to remind people about plasma donation. On coronavirus.ohio.gov, under our checklist station, you'll find some resources about donating plasma. Convalescent plasma is very helpful. It's rich in antibodies that could be used to attack COVID-19 as a treatment for the severity of the virus and for the length of duration. People who have fully recovered from COVID-19 for at least 2 weeks are encouraged to consider donating. You can find more information on how to donate at redcrossblood.org/plasma for COVID. So go to the Red Cross website, redcrossblood.org/plasma for COVID. Or you can contact any Red Cross local organization or plasma donor center. OSU's Wexner Medical Center is also a place that you can contact for ways to help. The Hawksworth Blood Center at the University of Cincinnati is another place that is also collecting it. You can find that at hawksworth.org. I know that Dr. Dean Kariakis at the Christ Hospital in Cincinnati, and I have talked about this many times, he's told me that even though this is in the investigative stage, that Ohio medical facilities are having success with this. So plasma donation, Ohio innovators in the medical care field are using this to help people not only survive when they're in difficult situations, but to even shorten the stay for people who are there. And then finally, talk a lot about sports and the return to play plan. Many non-contact sports have been active. We have a temporary order under specified circumstances to allow contact to go forward until the 15th of next week. We've launched the I Want a Season hashtag that we're using to try to remind young people that if they want to have a season, if they want to control the spread of coronavirus to their teammates and their family, they should wear a mask and socially distance. Very important. But we'll have more guidance. I know people want to plan. I know they want to, that when you think about sports and some of the contact sports that we don't have future guidance on, that will be coming next week. Wanted to keep you informed on that. We're trying to have these great conversations on what we're learning, talking with the sports organizations from around the state. That's Ohio High School Athletic Association, our college and professional teams, to make sure that we are learning on how to keep people safe, allowing them to participate, and we will be forthcoming with more information starting sometime next week. So that's my quick update on all of those topics. Please take advantage of the training opportunity. Please donate plasma if you've had COVID and you want to help somebody else out. So we'll conclude with that and turn back to the governor for a couple of more items.
Thank you very much. Just a couple other comments before we get to questions. One thing to note on the map is that Huron County was moved down barely. It was that close, but we're going to follow these numbers, and so that's a good thing. We're very happy about that, and we hope that continues to see other counties get a lower level of risk. Also would mention we had 18 counties move from yellow to orange. Of note, Highland County met 2 indicators, which you would move it, but it still remains yellow because they are a low incident county. This means they have, under the criteria we've set up, they have fewer than 10 cases per 100,000 for a 2-week period, which automatically makes them, according to our order, a level 1 county. Apologize for taking as long to go through each county. I want people who are watching this from one of these counties to at least be able to hear. I suspect what we will do going forward is we'll try to be a little crisper in the summarization of the counties. This is going to be posted, a basic summary of each of the red counties. That will in fact be posted, so you'll be able to go online and look at that particular county. And again, we have some counties moving around, a couple of them in the right direction, a couple of them some in the wrong direction, but the goal here is to try to keep you informed where your county is, best that we can do that. We have data that we shared with you, but we also want to put it into a category or again, a color that makes it easier, I think, to understand, particularly when you look at the map. And again, those counties that are on white